Loading here. Let me share my screen. Okay. You guys should be able to see that now, hopefully.
I want.
Then Emmanuel, are you getting set up here? If you're talking to me, you're muted, Emmanuel. Okay. All right, we'll go ahead and get started.
Okay.
Do you want me to read the questions to you, or and the answers, or just the questions, or?
I think just the questions is
Okay.
fine
Okay. Perfect. I can do that.
because my thing is lagged.
Okay. Early detection of hearing impairment is critical, which is one of the primary importances. Yep, speech development. So yeah, if there's a hearing impairment, you want to really focus on speech and vice versa. Good. Okay, multiple selects. A toddler needs stitches. What can make this easier?
Mm,
Yes, good. So use that numbing cream and then have child life involved if you have child life available. Good. And if you don't have child life available, some sort of distraction would be helpful. Okay, a parent recognizes that their toddler has a speech delay compared to their older siblings. What's your nursing priority?
a speech delay,
Mm-hmm.
I guess.
Yep, good. Yeah, you have to check their hearing first before you put them in speech therapy because a lot of times they may have a hearing impairment. Good. Multiple select. What are signs of an early indicator of impaired cognition? Yes, good. So not being able to grasp any object by 7 months. Okay. And it's not like that fine pincer grasp. It's just holding on, even like holding on to a rattle. Um, Nonverbal by a year, and then behavioral difficulties are all indicators of potential cognitive impairment. Child is being treated for a fever. The reason for treating the child's fever is yep, relieving the discomfort. Good. Multiple select. Child is complaining of something in their eye causing tearing and pain. What's your nursing action? Yep. So you can look and see if you see anything floating, like within the eye, and try to remove it, as long as it's not like, something.
Surgically. Oh,
Yes, something that's like a big deal that you shouldn't remove. And then the Fox Shield or anything that's penetrating the eye, you have to apply that. And then you should always check for your reaction to like your perla. Okay. But separation anxiety in a hospitalized child, which behavior indicates the stage of despair? Yep, regression. Good. Make sure you know the stages of anxiety for your exam. Okay.
stages of anxiety.
Yeah. So, like despair, all of that
Okay,
of
thank you.
separation anxiety. Yep. Multiple select. When can children react to the stress and anxiety of a hospitalization?
I don't know this one.
Yeah. So, before they're hospitalized, so in anticipation of being hospitalized, and then after they go home. Okay. Only during the hospitalization, that doesn't isn't
Yeah,
correct.
I didn't read only.
Yep. Yep. That's what happens on exams too. So make sure you're reading um before you quick pick. I know on here you have a timer kind of, so it makes it you feel like you need to pick more quickly. Alexis, if you're going to join us, the pin for the Kahoot is down at the bottom. I can give you a second to join us if you'd like. Sorry. Alexis, are you there?
Hi, yes, I'm here.
Okay. I just wanted to make sure you were there and that you can join us. The Kahoot's at the bottom of the code. There is at the bottom of the page. If you'd like to join us, I'll give it you just a second.
Okay, hold on.
Just let me know whenever you've joined, Alexis, so we can go to the next question.
Okay, I'm in.
Okay, perfect. Thank you. All right, multiple select. An adolescent goes to the ER for treatment without parents. How do you get consent for treatment? Okay, so it was a multiple select. So client that is 18 and competent, they can sign their own consent. Okay. Visit is considered an emergency, so initially consent is not needed until they're stable. And then getting a two-witness telephone consent from a parent or guardian is also acceptable. Okay. Not everybody can sign for consent, even if they're over the age of 18. They have to be competent. Okay. So that's why that last answer selection is incorrect. Good. Okay. A child is extremely fearful of something in the hospital. What type of play explores these fears? Dramatic play. Good.
I think my connection is bad. It's kicking me out. I'll try to log back in though, okay?
Okay. When checking on the IV of an infant, you notice that the tissue around the site is swollen. What's your first action? Yep, stop the infusion. Good. In helping a child to adapt to the hospitalization experience, the best approach is what? Yep, establish a daily routine and keep consistent to that schedule. Good. When assessing vision on a child, the healthcare provider would use the Snellen chart at what distance?
Uh,
20 feet. Yep, good. Think of 20/20, right? That's perfect vision.
yeah.
So 20 feet for the Snellen chart. Okay. Multiple select. Nursing care of discharging a child to home. Okay, so you want to make sure you're not giving only written instructions and only to the parents. Okay. So you're going to make sure you're providing written instructions, you're giving the verbal instructions, and you're giving those instructions both to the parent and the child. Okay. Even if the child is younger, you can explain it in a way usually that they understand some of the discharge teaching. You want to give them emergency phone lists, and then explain what's expected after their discharge and how the parents are, clarifying that they understand their discharge instructions by doing teach back or something like that. Okay. Good. Okay, another multiple select. So, what is the best way to alleviate stress and anxiety of a hospitalized child? Good. Yeah. Keeping the child on the same routine, explaining things developmentally, using developmentally appropriate terminology, and then allowing the parents to stay with the child. So you do not want to perform all invasive procedures in that child's room because you want that child's room in the hospital to seem safe to them. Okay. So usually children's hospitals have like procedure rooms that they take the children to. So that way they're not doing painful procedures, like drawing blood or starting IVs or injections or things like that in the room. So that way the child can still feel safe in their hospital room. Okay. Good.
Professor,
Yeah.
some of these questions are like similar ones to the first exam.
Uh-huh. Yeah,
So,
because here's the thing. You're gonna need to know developmentally appropriate um item. Okay.
mhm.
So throughout, you're gonna have to kind of know where kids should be developmentally based on their age and their stages of development. You're not going to be asked specifically, like, okay, what Erickson stage is this kiddo in?
Oh,
But
okay.
you still need to know developmentally where they should be to be able to
Okay.
answer your questions. Does that make sense? So there is a little bit of overlap throughout.
Yeah, because I was like, I know this is something
Yep.
similar.
Yep. So, like you need to kind of know what to expect for toddlers. You need to kind of know what to expect for infants. Um, and then how that relates to them being in the hospital setting or having a chronic, medical condition. Does that make sense?
Yeah,
Yeah.
thank you.
Yep, you're welcome. Yeah, so what is a 3-year-old's biggest stressor of being hospitalized? Being separated from their parents is the biggest stressor of hospitalization. Okay, good. Which urine collection method on an infant is most accurate? Okay, are you gonna very successfully catch a midstream urine or a clean catch on an infant? Probably not, because you're not going to be able to know at what point they're going to be urinating. Okay. So straight cath is your most accurate way. You will see some people use bagged urine specimens, but if you're looking for some sort of infection, that is not the most accurate way to get a urine. Okay.
Okay.
Good. Okay. A nurse notes a string tied around the infant's wrist. An appropriate nursing intervention would be what? Good. Yes. Ask them what the meaning behind the string is and leave it in place as long as it's not a risk. Okay. Good. Many infants require oxygen. What type is best tolerated and accurately delivered? So an oxy hood is the best tolerated and most accurately, and is also accurately delivered. You will see a lot of babies have nasal cannulas, and it's not wrong. It's just not tolerated as well as the oxy hood, because they have that irritating cannula kind of up their nose, so it's more irritating to them. Good. The primary goal in caring for a child with cognitive impairment is to what? Yes, good. Promote their optimum development. Keep them on track with their development as much as possible. Good. What is best practice for school age children with special needs? Good. Yeah, children with special needs are now being integrated into regular classroom settings. Good. Instead of keeping kids separated, they usually try to keep kids in the same regular setting. Good. Multiple select. Collecting a heel stick blood specimen on an infant. Yep. Use the outer aspect of the heel because there's less nerve endings out there. Okay. Only use a hospital approved heel warmer and then a lancet that punctures no deeper than 2 millimeters. you're puncturing further than that, then it's, it can cause more problems for that baby. Good. Referrals for cognitive impairment should occur when? So as soon as the cognitive impairment is being identified. Okay, as soon as they're struggling, you want to put in referrals for them. You're waiting until they're going to school, or you're waiting until they're able to communicate. That may never be something that happens for those kiddos. So making sure you're referring them as soon as possible so they can get all of the therapies and things that they may need in place. Okay, Down syndrome children have frequent upper respiratory illnesses. Why is this? Okay, they're flat, underdeveloped nasal bones. Remember, kids with Downs, they have that underdeveloped nasal bone. So they're more prone to getting URIs easily. Good. Multiple select. Down's children are more susceptible to what medical conditions? And it was a multiple select. Yes. So they're actually more prone to all of these. And we'll talk about leukemia today more in depth in my class. So this week. So congenital heart defects, particularly ASDs, VSDs are more likely in kids with Downs. Leukemia, hypothyroidism, and hypotonia, so low tone. Okay, so all of those are risks for kids with Downs. Good. Okay, another multiple select. What should be included in the plan of care with the patient with moderate cognitive impairment? Good. Yep. So daily structured schedule, selecting toys that are age appropriate but also developmentally appropriate. Okay. Exposure to different sights, sounds, sensations. That helps with their cognitive impairments. Okay. And then selecting play activities that and toys that are useful for teaching skills. Good. All right. Do we want to keep doing this one, or do we want to hop to like cardiology, cardiac defects?
I guess we can switch. We already did 26 of this.
Yeah, it's up to you guys. I was just thinking then that way you can get some of week 5 review as well. Okay. All right. We'll go ahead and do that really quick. I'll stop my screen share here. And Grant, I know you just hopped on a little bit ago, but you can join us too in the review if you'd like to hop on Cahoots.
Okay, very well, ma'am.
Okay. I guess, do you want to do cardiac or do you want to do respiratory?
I don't know.
I don't care either way. So whichever is fine with me. Alexis, do you have a preference of cardiac or
We can
respiratory?
do cardiac.
Cardiac. Okay, we'll
Yeah.
do that.
Thanks.
Okay. Share my page here, and you guys should be able to join. Perfect. We'll go ahead and get started then for week 5 cardiac material. Your exam is next week. Okay. Why would a child with tetralogy of Fallot not gain weight at the normal rate? Good. Yes. Inadequate oxygenation, which then leads to decreased energy to eat or get those calories. Good. Okay. Multiple select. Clinical manifestation of Kawasaki's disease is what? Yeah, so those blister, cracked, peeling, potentially palms and soles of the feet, palms of hands and soles of the feet. Okay, the reddened eyes, that conjunctivitis. Okay, and the strawberry tongue. Chorea, do you remember which diagnosis that was with? It was not with Kawasaki's, but something similar. Anyone want to take a guess? It was
Is it something virus?
no. It's something that happens after strep, potentially, for some kids. Rheumatic fever. So if strep isn't treated, it can progress to rheumatic fever, and that's something that happens with rheumatic fever is the chorea, which is those kind of abnormal body movements, involuntary body movements. So like shoulder rolling, tics, like in the form of like head jerking or shoulder shrugs, things like that you'll see with chorea. Good. Which of the following best describes the pathophysiology of Kawasaki's disease? That's what kids with Kawasaki's, their eyes will look like. Looks very dramatic, but that's very accurate. Yep, so it's multi-system vasculitis. Okay, so inflammation of those vessels that then potentially can affect the coronary arteries. Okay, so that's the big risk with Kawasaki's disease. And remember, with Kawasaki's, what do we give kids for treatment?
Is it aspirin?
Aspirin, and in the hospital, they'll get it as an infusion. Immune globulins, IVIG. Okay. But yes, this is one of the only cases that we give kids aspirin. Otherwise, no aspirin for kids because of the risk of Reye syndrome. Okay. But benefits, you look at the risk benefits for Kawasaki's, and aspirin is utilized. Good. Okay, what is the treatment for Kawasaki's disease? Oh, we just kind of talked about this. So you should all get it right. Yep, aspirin, IVIG. Good. Okay, multiple select. Why do you give aspirin to a child with Kawasaki's? Yep. So it has anti-inflammatory properties, it prevents blood clots, and it thins the blood. Okay. So that's what the benefit of doing aspirin is in a kiddo with Kawasaki. Good. An abnormal hole between the right and left atrium is called a what? Yep, an ASD, atrial septal defect. Good. What is the treatment for TET spells? Okay, yep. Remember that kneaded chest or a squatting position. You might even see the kiddos just do that naturally themselves as they're starting to notice they're having a spell. Good. Okay, multiple select. Why are prostaglandins given to a child with transposition of the great arteries? Yep, good. So it helps to oxygenate them and it maintains cardiac output, right? We want to keep that open, PDA open, so that way these kids are getting oxygenated, because if it closes, they are no longer going to get access to the oxygen. Yep. What is the purpose of giving indomethacin to a neonate with a PDA? So indomethacin closes the PDA. Prostaglandin keeps it open. So the purpose of doing the indomethacin is to close that PDA, so they have better cardiac output. Good. Transposition of the great arteries is, what's that defect? Yep, so the pulmonary artery and the aorta are switched. Their locations are switched. Okay, so they're opposite. So if that PDA isn't open, the blood isn't circulating to the lungs like it needs to. Good. When measuring blood pressure on 4 extremities of a child with coarctation, you expect what? Blood pressure is going to be lower in the legs than the arms. Okay, so if kiddos have coarctation of the aorta, your blood pressure is lower in the legs than the arms because of that narrowing or coarctation, that kinking off kind of the aorta. Okay, so the pressure is going to be lower in the legs than the arms. Good. Early signs of heart failure in an infant include Yeah, poor feeding and sweating. Okay. Cyanosis. Clubbing is going to be a later sign. Bradycardia will also be a later sign. Okay. And some cyanosis at birth is kind of normal, but right around the lips initially. But then they
They have what was it called? Blue baby. What is blue baby again? Where the aorta and the vena cava are swapped?
The aorta and the vena cava, or the aorta and the pulmonary artery.
Pulmonary artery. I'm sorry.
Yeah, yep, nope, that's fine. So yeah, the pulmonary artery and the aorta are swapped on transposition
Okay.
of the great artery. But tetralogy of Fallot, also you'll have blue babies with that. Okay. But cyanosis right at birth is not super uncommon across the board for all babies. That's why that option was incorrect in this scenario.
Okay.
Yeah. Because it takes a little bit for their PDA to close and everything start working like it should. Okay, multiple select. Signs of heart failure in a 3-week-old with congenital heart disease. Okay, so you're going to see some edema in kids with heart failure, okay? Tachypnea, tachycardia, good. Those are earlier signs. And hypotension, okay? You would not see warm extremities. You would see cool extremities, okay? Good. And you would see weight gain, not weight loss, because they're going to hold on to that fluid just like adults do with heart failure. Okay? Good. Okay, another multiple select. Feeding the infant with heart failure. What are you going to want to focus on? Okay, so the feeding in larger amounts, usually they're going to have more frequent feeds, smaller amounts for infants who have heart failure. Okay. You're going to increase the calorie of the formula so that way they can gain weight better to grow. Holding the infant upright, monitoring for diaphoresis, tachycardia, tachypnea, vomiting, any of that is happening, then you're getting concerned that their heart failure is progressing. And then any amount of calories that they cannot consume in a 30-minute window then needs to be lavage through like an NG or an OG tube. Okay, good. After heart transplant, what is the leading reason children die? Yep, rejection. Good. Nursing care following cardiac catheterization. Yep, good. Yeah, looking at that site for hematoma, blood, any of that. Okay, you don't want to raise their head abed. They need to be laying totally flat. You don't want to ambulate them, and you don't want to elevate the affected extremity. Okay, so totally flat. You're going to be checking that site for hematoma, bleeding, any of that. Good. Where is the patent ductus arteriosus? Yes, good. The vessel that connects both the aorta and the pulmonary artery. Remember, this is the one that we want to keep open after delivery for kids that we know that have transposition of the great arteries. Okay. And we keep that open with prostaglandin. Now, in a normal healthy kiddo, that the PDA doesn't close within the first couple of days, then they'll be given indomethacin because there's no purpose that that PDA has to stay open once they're out of the uterus. Okay, good. Okay, another multiple select. What are signs of digoxin toxicity in infants? Or what is a sign? Yes, good. Nausea, vomiting, and a low heart rate. Okay, so heart rate under 90. Good. What are signs and symptoms of heart failure in children? So we're not thinking about the little infants now, we're thinking about children, so a little older. All of the above. So fluid accumulation, palpitations, shortness of breath, all of those things you can see in heart failure in kiddos. Good. Which medication is commonly used to relieve the spasm during TET spells? Morphine, okay, because it kind of opens things up, relaxes the kiddos, and improves cardiac output. Good. This is the last question, then we'll stop for the review. The key to preventing post-op complications. What's the key to preventing post-op complications in kids? Early ambulation. Okay. Good. Just like with adults. That way they're not getting clots and things. Okay.